Okay, so essentially what I'm going to do is just to remind you of the key points from the presentation this morning, and then after that it's a surprise. So, and I'm looking particularly at part one this afternoon. We're not going to go into any of the detail around any of the other parts. So, as you'll remember, I'm sure from this morning, one of the intended effects of part one is to expand the provision of local primary mental health support services. And that is going to be done through local mental health partners developing their joint schemes, and schemes relating to a local authority area or areas. And that the schemes will cover people of all ages registered with a GP and people set out in the regulations, and that over and above that, schemes may cover people who are subject to the Mental Health Act or people in secondary mental health services. And the nub of the services are across these 5 functions around assessment, provision of treatments, making of referrals, advice and information and support for primary care providers, and information and advice for individuals and their carers. And we're expecting to be in a position to have all this worked up and able to implement part one by summer next year. So we've got about a 12-month time frame. And then just to go over the work that's underway to support the implementation around the appointment of local leads, the national service model, the mapping exercise, drafting the subordinate legislation, and preparing guidance for local partners on agreeing their schemes. I also mentioned the money that's available, the $500,000 that's available during the current financial year, and the expected $3.5 million that's going to be hopefully available from next year onwards. So this is where you get involved and you have an opportunity to shape the implementation. And the idea is that we break up into 3 groups. And there are 3 topics that I would like you to discuss. So each group will look at a different topic. So the first one is around promoting part one, how we increase engagement, who needs to know what do they need to know, and how is the best way to get this information to them. The second one is around record keeping, given that the people who will be delivering these services will not be employed by primary care. So they'll have to keep their own records. Primary care will need a record. So what needs to be kept where, and what would be the information flows? And then the third group is, what are the challenges to implementation? What risks do you see? What is going to be fundamental to have in place for this to work? It would be helpful if at the end you could feed back on the top 5 issues that you have identified.
Every consultation will have a mental health element in it. And I'm just wondering, are there really the resources, given there's no real extra money for this, to be able to provide for everybody with an identified mental, because you can't do a plan on everybody.
So I'm not sure what we're talking about, implementing what.
Yeah. I suppose those organisations who are already using CPA have already got some of this in place, whereas the other organisations haven't even got that in place.
Because they're looking at the planning and the provision, about working with local authorities, about the all ages. So I think that's a bit different for us from secondary care, is the all ages. Because now we've got the older people, it's children and adolescents, isn't it?
And 2 about confidentiality of issues as to how...
I coordinate private mental health working in 3 boroughs in Gwent, albeit we're very small numbers, but I do. And my understanding in relation to implementation of the mental health measure will mean a very large increase in relation to assessment, an increase, or in some circumstances, a complete change in direction in offering a direct work element, where prime mental health working in some boroughs does not offer a direct work element. It has been tried in some boroughs, it was tried, and basically the demand just was massive. Having worked quite a lot with GPs now, understand the demands and pressures that you're working with in relation to time elements, because we've talked about engaging in joint assessments with us, and some GPs have. Very often, more often than not now, GPs are saying to us, I have not got the time to do so, and I truly understand, having had a snippet into the life, I understand exactly why that is being said.
I suggest, you know, we're talking about resource shifts and things like this, I don't know.
What is the impact going to be on the staff? Because if somebody becomes ill because of their workload and they can't be backfilled, it means greater workload for a diminishing number of people. And I've seen that already, and if you don't have a workforce, you don't have a service. So what is there in the measure that's going to protect the frontline people?
If we think about primary mental health services,
But this is potentially going to make this could make a lot of people very ill. And it's going to become a real ironic, it's going to become a paradox that the very service set up to improving mental health is going to create mental ill health.
I mean, do you think, how much do you think it's adequate?
I've got to be honest, you know, you can't enter into a great dissection about things. You know.
Where would you get the direct provision then? If you assess somebody and they needed a direct provision, where would you go to deliver that to the young people?
Can I just, where we've only got 20 minutes, I know we've got a couple of colleagues in the voluntary sector here. I just wonder what the issues are in in the voluntary sector about communication around.
I think we've been engaged with extremely well.
I suppose that's true. I suppose our thing is how to practically link in so that when the measure comes in, how the third sector is there working alongside the GPs and that support that voluntary sector groups can provide. Because currently, you can't have that anyway. There's nobody with a specific contract with the third sector.
Long way to go.
It's how to make them effective in different circles is the challenge, perhaps. Could I ask a general question about wamhinpc? Clearly, I'm massively enthusiastic about the fact that we've got GPs, primary care around the table saying, I love mental health, which is quite rare. Is membership of wamhinpc a voluntary arrangement? Yeah, that's what I thought. And what percentage of GPs across Wales are actually members of wamhinpc?
Well, we don't actually have a membership as such. So people can say, I mean, people come to conferences, people can use the website. So it's an open forum really, rather than a membership organisation.
Because wamhinpc doesn't really touch that many numbers, does it?
No, I mean, people have to, in some ways people have to, I mean, we are sending stuff out, so we are pushing stuff out into the workplace, and that's something we've only had the capacity to do in the last year or so because of funding, and we've got to be very careful about keeping hold of funding. We've got another year's funding, but we don't know anything more than that. If we don't have funding, we can't do things.
I'll put you on the spot now. Then when you get a GP to a meeting, they say, fine, I give my views, but I don't represent anybody. And that's...
What about the staff? Where are we? I think that's
Staff well-being.
Yeah, I think that should be...
I don't really.
Thank you very much.
It's
It's been really encouraging just floating around and hearing the discussion. What I'd like you now is to feedback from your groups, just to feedback on the top 5 issues.
Right, we'll start with number 1. We think there might be a demand by overburden of the service across all the services. I mean,
so you think that demand might actually exceed capacity?
Yeah. I think there's a fear that that might happen. That could be a risk.
We'll do. I was paying reference, if I read correctly, to saying that the measure is not replacing everybody's business, the key document working within child and adolescent mental health services. But the very fundamental core concept of that is that children and people's emotional health and well-being is everybody's business, and a real clear promotion of training and consultation for primary care professionals. If I'm reading the documents correctly, then I'm seeing a much clearer drive towards assessment and direct work.
And the problem with primary care is that people have several labels. The secondary care model, the philosophy, is that you have anxiety or you have depression, you have something else which gets processed in this way. In the practice I work in, we have a CAMS system where the CAMS team are part of the team, so we can refer directly through our software for that help. And I also, as a GP, will do mental health work for people there. So there's this idea that general practice that deals with complexity in a different philosophy would be able to pull down the resources, including the extra support, that is focused around the work of general practice and primary care and harnessing the quite considerable resources within there close to where the patient is and their families are.
Practice nurses are probably going to be sort of key to this. According to one of our colleagues here, that they don't particularly work closely with counsellors at the moment, but they do see a necessary role, for example, around mental health problems in chronic physical illness and things like that. So they'll be a key group. Where we've got them using the current sort of link nurses or liaison nurses, there'll be a huge help with communication there. But again, the provision of those as patches will probably pick up in the mapping exercise. As mentioned earlier, the neighbourhood care networks, or whatever you call them in your area, under Chris Jones's proposal, they might be useful. I know in my area that I've found they've appointed a mental health nurse, or are in the process of appointing a mental health nurse. Haven't even come to talk to us about the measure and how that's going to relate to it. So we are picking up issues like that. Third sector I've already mentioned. Practice managers will be key. Again, not least because they're the ones who will answer their emails, as Mark pointed out to us.
So generally, you've identified groups who need to know about the measure, and specifically Part 1.
Yeah.
Yeah.
It's a long-standing complaint that getting the message out to primary care about anything is difficult, and it doesn't always, for other issues, it's a sort of a luxury. But for these teams to work, primary care have really got to be involved, and it's a necessity that we get the message out to them.
Yeah, thank you very much. So who's feeding back for you, is it, Ray?
Yes. We were looking at record keeping, the issues of record keeping for the primary mental health support services now that we work. And we identified, I think, from people who were already working in that field, that they felt that the best way of doing that was to be able to share those records or to put directly onto the general practice record, and that allows for information to be shared quickly, effectively. Although, and I think in those services they're talking about, they keep a written record themselves, but the actual working record, a copy of that, the actual working record is the one that's on the GP surgery, and they felt that had specific benefits in being able to get information to general practitioners. It's on a place where people can see it, and general practitioners and people can know it well. We did identify that depending on how primary mental health services are going to be configured in various areas, access to those records may be more difficult. And the way that this is working well is because people are actually doing a lot of work in those surgeries and have access to those. But for others, this may be, depending on primary mental health services, may be more difficult. And there's a sense that actually in various areas, this means how the records are kept need to be negotiated depending on how closely and what kind of relationships the primary mental health support services have with the local practices.
Thank you very much. Well done.